Have them set their bottom close to the edge of the seat and then assist them to lean back, bringing your knees to your chest. Go ahead and hold on to those. Good job. I'm going to have you go ahead and bring this leg down gently, keeping that leg straight. And what we are testing here is your iliopsoas and making sure that it goes all the way down to the table. So that would be a negative on the Thomas test. If it was positive, he would be holding tight. And you take a measurement to the table.
Yes.
Okay. So
Take a
you
measurement into the
take a
hip
measurement
extension.
of the extension that is in there. Okay.
So you do a hip extension measurement.
Oh yeah, because you would be here. Yeah. So you would measure here.
Give the landmarks for hip extension.
So you would need your greater trochanter, kind of wiggle it to tease it out over here on the side.
Internally rotate it.
Internally rotate it. There it is. And then, that's funny. Yeah, attaboy. Okay. And then your stationary arm, midline of your trunk here, up your thorax, and your moving arm would be to your lateral epicondyle. Femoral condyle. Slow down. All right. You want a second? Are you good?
Yeah, I'm good.
Okay, you're good. So in this same test, we would be testing for the rectus with the knee to see if we've got 80 degrees of flexion at the knee. So he looks really close to 90, but to test it, you put your axis on that femoral condyle on the lateral side, and then go stationary arm back towards the midline of your femur here, and down towards your, there's that malleolus on the lateral side. Okay.
Less than 80 is tight, right?
Correct.
Yeah, so
Yes,
if you
that's
were
it.
here, that would be
Oh,
tight.
oh,
So-
sorry.
So that would be a positive on the Thomas test
Mm-hmm.
for your rectus. All right. So now the other thing that you're looking for, right, when you're up here is for medial rotation, internal rotation or external rotation, because if you were, okay, don't screw this up, buddy. Okay, so if you are turning in
Test leg.
your test
Test
leg.
leg.
So we'll go back to the test leg. So if you were turning in, that would be your sartorius.
Nope.
No.
So no, that would be,
You're externally rotated.
If I
so
was-
external rotation would be sartorius, inside would be your TFL IT
If
band.
I was a little
TFL or IT
bit
band.
adducted, it'd be
Remember,
Those would be
internal
your
IT
adductors,
band.
uh,
II.
Adductors, no, I said backwards. Abductors, if it was going in or out.
If they're adducting, they're tight.
Deducting.
Adductors.
So adductors,
If they're out
abductors.
like that, they're tight.
abductors. Okay, which is all done in the Thomas test.
Right.
Okay. Ogre's test, we go sideline. Okay, we want to make sure that we keep those hips stacked, one leg out of the way. We're going to bring this leg up and into extension, and then I want him to come down, down. And since his ankle's hitting, I'm going to actually bend the knee a little bit. I can bend that knee a little bit and see if I can bring that knee all the way down. So I'd actually say that he's positive on the Ober's test. So what I would do is take a measurement here from his knee down to the table, from his medial malleolus down to the table. Okay. So straight leg raise, we're going supine. Okay, so straight leg, you're testing, that would be your psoas, right? Because your rectus, I guess it'd be both of them, right? So we go straight leg, I do passively, and then you would go ahead and do it?
Now this one you're
And
gonna
then take
have
a
to,
go.
this one you're gonna have to just
Try
take
to-
him up to his end field.
Take him up to
This
his
is gonna be a
infield.
painful stretch.
That's gonna be painful.
So you take him up to his end field.
And making sure that his hip doesn't come off the
Correct.
table.
That's my input.
That's it right there. I wasn't gonna go any further. It felt like it was it. But you would take a goni measurement from that one.
Correct.
So now we're back to the goni on that one. You're gonna take the goni measurement when he comes up, which is kinda hard, so you gotta be kinda quick.
So what are your landmarks for the Goni measurement for the hamstrings?
So I again go off of my
Great leg raise.
greater trochanter. Stationary arm is midline thorax, and moving arm
Very good.
lateral femoral condyle. Okay. So then we do the 90-90 test, where you basically do that, bring your hip up into 90, knee is at 90, 90-90. And we are trying to see if you can straighten that leg. Normal would try to be at that 20 degrees, minus 20 degrees,
Yeah.
minus 20 degrees, which doesn't look like he is there at all. Okay, so we would take a Goni measurement here to see where exactly you are from your axis being, again, on your lateral femoral condyle here, midline of your femur back to your greater trochanter, and moving arm to your lateral malleolus.
And with this one, the patient can assist you by holding
Holding.
the back of their leg.
Okay. So go ahead and hold your leg up there. Okay. Because then it'd be easier to take the Goni. Okay, cool. Good. Relax. Okay. Now quadriceps.
There's one more.
Oh no, hamstrings at the knee, which is, isn't that just,
So it can either be in prone or supine. just
Okay.
like that.
so hamstrings at the knee is this one, which I'm pretty sure you guys said you're not gonna put on the comp because it's so
Anything's
simple.
possible.
But anything's possible. Just remember, if it's hamstrings at the knee, you're just wanting to bolster the ankle to see what that extension is.
There you go.
Alright, so quadriceps, normal flexion, generally tested supine with the hip flexed to 90. Why am I not seeing that?
Take your time.
So your supine, your quads
Flex the hip.
flexing the hip
Mm-hmm.
to 90?
Uh-huh.
Okay.
And it's like,
Well,
have the
that's your
patient
knee.
hold
That's your
their
hip.
hand, have the patient hold the leg, right, their hamstring. Okay.
And what are you measuring?
The,
Doing-
Flexion.
If you're doing the length of the quadriceps.
So this is knee flexion. So
What's
I'm
the
measuring-
job of the quadriceps?
So the quadriceps are flexing,
What do
or
the quadriceps
extending,
do?
Extending.
So
extending
you
your
have to
knee.
measure
Flexion.
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 Oh, okay.
There
Okay.
you go.
I don't know why it wasn't clear.
Think through it,
Okay.
think through it.
Okay. Think about what the muscle does, and
You're
we're
doing
basically
great,
doing
bud.
the
No,
opposite.
You're doing great.
Okay. So, he would bring his knee up 90 degrees, and then bring his knee down into flexion. Take the Goni off of that. Again, you're on your lateral femoral condyle, midline of your femur, and down to your lateral malleolus.
Good.
Okay. Relax. All right, so the Eli's test. Eli's test is done prone. And the Eli's test, what we're watching for is that anterior tilt in the hip. So what I want him to do is bring his heel back towards his bottom, like this. And you go ahead and perform it. So he definitely moves a little bit, but not a lot. Go ahead. And that's basically it, right, on the Eli's test.
Well, what do you do?
Yeah. I thought that's it.
No.
That's all that's written down on that paper. That's what we were confused about earlier.
Okay. Take him passively,
So passively,
flexion.
knee flexion,
take him to his infield.
infield, soft
now
tissue
what would you do here?
approximation. He should be hitting 135.
Okay, so his normal would be 135, his
Mhm.
infield would be?
Soft tissue approximation.
Okay, so what would you do next?
Goni.
Give me
So-
the landmarks.
So Goni, again, we're on our lateral femoral condyle,
Mhm.
the stationary arm of that midline of that femur, back towards your greater trochanter and lateral malleolus.
Very good,
Moving on.
got it.
Cool. So that's just the other part of the Eli's test is once you get
Yes.
them up there,
You gotta
you
take
want
it
to take the
over.
Goni. And gastrocs,
Oh, wait.
by sitting on the edge of the table.
Yeah.
So sitting on the edge of the plank, knee is bent. So since the knee is bent, we are doing soleus. And your soleus does plantar flexion, so we're gonna do dorsiflexion, normal is 20, that's a firm in feel. So we perform that and then have you do it and then take Argoni. So we are just distal to the lateral malleolus and we are going stationary arm up towards your lateral femoral condyle and you're straying parallel with your styloid process of your fifth metacarpal over here, or tarsal.
So fifth metatarsal for the moving arm,
Mhm.
or parallel to the
And
calcaneus.
fibular head.
Fibular head.
Fibular
Yes.
head.
Good.
Before you even started your cue, man. I
So
was
you
like, wait,
kinda-
wait.
You kind of saw me going.
Yes, sir.
Okay.
Yes, sir.
All right,
Yes,
good.
sir.
You're
Okay.
doing magnificent.
Okay. So I want your knee straight for gastrocs.
Normal range of motion for soleus.
You should have 20 degrees of
Good.
dorsiflexion.
Okay.
So you could just sit up on the table. You don't have to lay down, right?
I'm
You-
comfortable.
You could lay
You
down.
can be
Yeah,
long
supine-
sitting or
supine,
supine.
knees extended.
Okay, as long as the knee is extended.
Yeah, because you don't want, if you sit up, what happens if you sit up?
Probably gonna make it tight.
It'll make the knee flex,
Oh, true.
and you
'Cause
don't
it
want
makes
the,
it.
you don't want the knee to flex.
Right, right, right.
Okay.
Okay, good call.
Okay.
Okay,
I
so
understood.
I want to get you in a neutral position because I want you to again perform the same action where I'm going to have you dorsiflex. Yep. Okay. And go ahead and perform that action. And again, we take the same distal to the medial malleolus,
Lateral.
lateral malleolus. Thank you. And parallel with your styloid process of your fifth metatarsal, and stationary arm is the fibular head.
And normal range of motion?
Should be 20 degrees again.
Nope.
Firm
10.
infield.
10.
10. 10. 10.
10 for gastroc.
10 for gastrocs, 20 for soleus. Okay.
Okay.
Isn't there still another one? So upper trapping scaling is basically the shrug action where you are going to bring your shoulder up. No, that's the actual. So I want you to tilt your head away. So that's upper trap and
So I gotta hold it.
true. So stabilize on the contralateral side with the hand. Have him cervically, laterally flex his cervical spine. So actually, I want to be behind him.
Bring your left ear towards your left shoulder.
Yeah, but you'd want to be behind.
You would.
Yes. Okay. So what I want you to do is go ahead and perform this action. So this is upper trap and scalings. It's the same motion, we can just say, to do the levator scapula by taking your arm out to
What do you
90.
do, don't,
You gotta
Okay.
go to my
Finish
just.
the
Okay.
test.
Okay. Well, it's the same test for both of them, though.
Okay.
Off of your C7 is your apex. To draw that out, I might have him flex his neck and find that C7. Go ahead and tilt your head back. Okay. And then your moving arm is in line with your occipital protuberance here, and I can go perpendicular to the ground.
That's fine.
And then what I'd have you do is go ahead and perform that flexion laterally, and then you would perform the lateral flexion, okay? And then take the measurement. That's a firm infield, 45 degrees.
Why don't you do the other one with pillows, so you actually.
Cool. All right, where I tried to jump ahead before. So this would just be your levator scapula. You've got the arm adducted to, or deducted to 90 degrees. And then we perform the same action, cervical lateral flexion, coming back up. When he performs it, again, C7, occipital protuberance, perpendicular to the floor. I just dropped all that knowledge on you guys.
That was awesome.